Welcome to MindMatters Masterclass. It gives me great pleasure to introduce our guest VIP speaker tonight, Miss Vickie Barbier. She is a registered ACT practitioner because tonight we're going to delve into the topic of acceptance and commitment therapy, a modality that is fast gaining traction, really popular among counselors and therapists in this day and age. Vickie is an integrative hypnotherapist and she integrates ACT into most of her work. She's going to share about her work based in UK. At this point of time, can you guys please help me to welcome Miss Vickie Barbier? Okay, over to you, Vickie.
Thank you, Glenn. That was a really nice introduction. So I am, like Glenn said, a hypnotherapist, and I'm also a mindfulness teacher. And that's why I was drawn towards ACT as a modality. What I do is I work in private practice, and I also work in a hospice, in a day centre, which is a great privilege because although a hospice can sound a little bit scary, and I do work with people very close to end of life, I'm very often working with people who've got a few years left to live. And so these are people that really want to work through issues they've had in their life, improve their relationships, and really gain a good quality of life. So I'd like to talk with you about ACT because this is a modality that I found so useful to integrate into my mindfulness work and into my one-to-one work with people, not only in palliative care, but people who want to increase resourcefulness, people in businesses are asking for courses to improve resilience. And it's a very flexible modality. So I was saying that acceptance and commitment therapy was developed in the 1980s by a psychologist called Stephen Hayes. It's got a strong evidence base. And the core reason it works is it develops psychological flexibility. It's comprised of attitudinal flexibility, attentional flexibility, and behavioural flexibility. And ACT has been shown to be effective in conditions like anxiety, depression, chronic pain, people who experience cancer-related distress, people in palliative care. And that is an area that I work with people in. As I was saying, I was being privileged to work with people in the day services unit of a hospice. And I work with them for either a short period of time or a longer period of time, come to terms with very difficult life circumstances. So they're, of course, coming to terms with the end of their life, coming quite often within a few years, but they're also dealing with relationship issues, dealing with what's happened in their life. And it's my job to help them live their life with as much joy and contentment as possible. And it is incredible, but people in incredibly difficult life circumstances are able to find joy. They're able to find meaning, and they're able to move into the life they want to live and create such beauty as they move through it. I also work with people from the general public who experience anxiety. I lead mindfulness courses, and I work with businesses in resilience building. ACT is a creative and compassionate approach. One of the things it really develops is self-compassion. It is mindfulness-based and experiential, and that's why I was so drawn towards training in ACT, because of my mindfulness background. ACT helps us respond flexibly to the difficult thoughts and feelings that arise as a part of normal life. It's not about avoiding discomfort, but it's about finding out where our true values lie and moving towards a life of meaning. It reduces experiential avoidance, cognitive fusion, and attachment to stories of self. It's a really grounded and embodied process, which is one of the reasons I really like it. But it's a huge area, and I don't want to give you a technical lecture on what ACT is and how it works. So what I'd like to do today is take you through a couple of processes that I found really useful, and we're going to weave them together. So it's dropping anchor, and also we're going to look at diffusion. So we can all agree that life has its storms. Challenging life events happen, and we have difficult thoughts and feelings and emotions that arise within us, even if there seems to be no external difficult event. And when we experience strong emotions and difficult thoughts, our first-hand instinct can be to run away from it and hide, to try and distract ourselves from it, or it can be to fight it. But these aren't the most effective ways to deal with a storm, whether it's a real storm or an emotional one. In ACT, we see these processes that arise within us, the thoughts and the feelings, like a storm that we can't fight, that we can't run from, that we can't ignore. And the smartest thing we can do if we're out at sea and there is a storm is to learn to drop anchor. And dropping anchor helps us center ourselves while we're in the storm. It won't stop the storm, but it will anchor you and keep you steady. The wind may still be blowing and howling around you, but you're not being swept out to sea. You're present and here, and when the time is right, you're ready to move towards what really matters to you. So we're going to briefly explore that now. I said ACT is experiential, and that's what I'd like to do with you right now. So I'm going to ask you to either close your eyes or soften your gaze, or at least, just for now, look away from the screen. Notice where your feet are. I'm doing this with you. And notice the position of your hands now. Is there any tension there? Any tingling or sharpness or ache? And as you pay attention to your hands, what do you notice? There's no need to change anything. Just notice. And now I'll bring your mind to what's going on inside. What's happening with your thoughts right now? Are you thinking something along the lines of, what is she doing? I'm bored. Or your mind may have wandered off to what you're going to eat later. Just see if you can stay in touch with my words, stay in touch with your body, and whatever thoughts are coming through. Now notice that these thoughts arise automatically, and you can be aware of your hands and your feet at the same time. You can be aware of the breath as it moves in and out of your body. And notice that you're able to wiggle your toes or your fingers. You have some volitional agency over your body whilst these thoughts are going through your mind. Thoughts arise automatically, and you have the ability to move your body, to focus your attention while staying present to the storm of thoughts and feelings. And now, listen to the sounds that are around you. And move your eyes to something else. Notice that you're able to engage with the space whilst maintaining awareness of your body and awareness of whatever storm you're in. You're able to perhaps roll your shoulders, move your eyes around, and direct your attention where you choose to direct it. And right now, I'm hoping that you're going to choose to direct your attention to this talk. So that was a small example of dropping anchor. Fusion is when we get caught up in a thought. Fusion is when our thinking feels like who we are, and when the thought takes over or hijacks our actions. So when we drop anchor, very often the first step we take is some diffusion from our thoughts. Fusion is when our thoughts are so close to us that we can't even see that they are thoughts. They become a part of our identity. So defusion is a process in ACT where we notice that we are the ones that are thinking the thought. The thought is not who we are. We create space between us and the thought. We stay connected to what matters to us in life and choose how to act, how to go forwards flexibly. So a lot of diffusion techniques in ACT use metaphors. The main thing is that instead of being dominated by our thoughts, we recognize that they're transient events that move in and out of our mind. And this shift, it doesn't sound like much, but it's incredibly powerful because it enables us to respond more flexibly and align our actions and values. It's as if we become a bigger person. So now I'm going to explore a few metaphorical ways that we can diffuse. And the reason I'm going to go through quite a few is because everyone has their favorite. So I'd like you just to see which one clicks for you. So I'm going to start off with the one that clicks for me most. So here we've got a book with the not good enough story written on it. So in this metaphor, we imagine the mind as a master storyteller, weaving narratives about who we are, how the world works, and what is possible for us. So that I'm not good enough thought, it's not just a standalone statement, it's part of a larger story that many of us get pulled into. And these stories can be so compelling and they influence our actions and our emotions. When we recognize that this is a story, this is a narrative, we can take back our power. We acknowledge them without becoming entangled in them. This gives us greater flexibility in how we move forward in life. And for me, when I recognize that I'm in the not good enough story, it gives me a sense of lightness and relief. And it's almost like humor kind of descends on me. The next metaphor is that of the mind being like a radio that can sometimes get stuck on a critical station, broadcasting messages like, not good enough, you should be doing more. So in a fused state, we might listen to this radio all day long. It might be turned high, and it influences how we see the world and our behavior. And notice here that sometimes the thoughts that arise may be true. We're not here trying to determine the veracity of a thought. We're not debating with it. We're not trying to get tangled in with it. The very act of noticing it is a thought gives us a sense of expansiveness and flexibility. Some of the thoughts that arise may indeed be true. So a lot of people that I work with have thoughts like, I'm going to die soon. There's no denying that. And in the face of this, how is it that they're going to live? So when we have a radio station broadcasting loud to us, it can influence our behavior because it influences how we interpret the world. But we don't have to engage with it. So let's take the thought, I'm not good enough, as an example. A common way to diffuse from a thought is to go through a verbal structure because our thoughts are comprised of words, and they're comprised of images in our mind. And when we alter the language, it can help us see that they are thoughts more clearly. So if you say, I'm not good enough right now, and you allow yourself to get pulled into that, to get fused with it, and then just say to yourself, I am thinking I'm not good enough. And notice what happens. And then I notice the thought, I'm not good enough. Now, for some people, they get a sense of space here when they do that. And don't worry if you don't, because there's many ways of diffusing from thoughts. So when this woman starts to notice that she's thinking, she's able to look up and engage with her environment. The thought is still here. And it's important to notice that we don't get to choose those automatic thoughts that arise in our life. They come from all the ways that we've been impacted, from infancy, from our culture, from television, from many, many different sources. But when we recognize that, it does give us the ability to gain more volition over the way we want to go forwards, to not be tuned into the automaticity or the autopilot. So here we've got a brain talking to the man saying, you're no good at your job. People are going to see through you soon. And the man is saying, thank you, brain. I know you're trying to keep me safe. So this is a form of psychological flexibility. Throughout human evolution, humans have had to be vigilant to threats and to potential threats in order to survive. Our ancestors needed to anticipate dangers, and we've inherited this vigilance. Our mind is great at spotting problems, including our perceived personal shortcomings. So as human beings, we needed the tribe around us to keep us safe. We could not survive alone. And so any type of social rejection or failure was akin to death, really. So our minds are trying to be helpful when they highlight our flaws to us, because the intention is protective. It wants us to stay in line, to stay within the tribe, to stay safe. But it often leads to unnecessary self-judgment. So in ACT, we see the way the mind talks to us is inherent in our human conditioning. But it does need work, because when we recognize this, that it's natural that so many people are walking around with these self-judgments, with this harsh critical voice inside them. And as I'm sure you know, there can be many critical voices and many parts, and ACT translates very well into parts work. We can use approaches like ACT to help us update the relationship we have with our minds. And so this is a little bit too in-depth for us to go into here, but the first step is the one on this slide, to acknowledge the thoughts by thanking the brain or thanking the mind, and to recognize that it really is genuinely trying to help. And this simple phrase recognizes the space between us and the thought. And the distance gives us the choice about whether we're going to engage or allow the thought to be there, where it will maybe pass in its own good time, or maybe stay around for a while. In a way, it doesn't matter, because we choose the way we go forwards. The next metaphor I'd like to look at is called the passengers on the bus. So if you imagine that you're the driver of a bus And your thoughts are like the passengers on the bus. They can ride along, but they don't steer the bus. So I wonder who is on your bus today? Maybe there's a voice inside you saying you're not good enough. Maybe there's some shouting at you, telling you to stop whatever it is you're doing. Other voices may be telling you to veer off. Other voices may just be rather grumpy. And there may be other voices inside you that are more pleasant. So in this scenario, you are the bus driver. You have a choice. You can stop the bus. You can turn around and argue with those passengers, but you don't need to give them the steering wheel. You can continue driving towards your destination, towards your values and your goals. So this is just another way of saying what I've been saying. You can't always control the thoughts and the feelings that arise. We can't choose who gets on our bus, but we can decide to stay on the designated route that we are on. And we can recognize these passengers for what they are. They come on, they get off, and we continue. Another metaphor demonstrates attitudinal flexibility. So if you imagine your mind as a large screen, this is the last metaphor, by the way. I know there's quite a few. There's loads in ACT, not just in this process. And this large screen is playing a movie, a drama that you're getting really caught up in and pulled into. So it feels like you're living it. The sound is turned up high and you're really involved. There's thoughts, memories, predictions, emotions all going on. And the rest of the room seems to disappear from view. But when we recognize that we do have the ability to shift our attention, that we can stream the movie on maybe that tablet that's there on the table instead, we're then able to look up and see the book, appreciate the plants, take a sip of a warm drink from the mug. And at times, it's as if the movie's on an even smaller screen, like the phone on the windowsill. The sound is down low. We don't even need to try to move it away. The recognition that it's a thought, that it's a movie, means we have the capacity to decide where to focus our attention. It's about relating to our thoughts differently. We don't need to try and silence the mind. In fact, as a mindfulness teacher, I know that that's impossible. It's one of the things that I teach in meditation, that we're not trying to silence the thoughts. So ACT looks at values. And I don't have time to go into this now. This is a really important part of ACT that I am not serving well, but I'm just illustrating this process for you briefly. If I could wave a magic wand right now so that all your thoughts and feelings didn't get in the way of you living the life you wanted, what would you really want to do right now? What kind of person would you like to be? And those questions can give you just a little hint of what values you'd like to be moving forwards in now. And so now we're going to talk about dropping anchor. The first step of dropping anchor is to acknowledge. And this is where it's going to be helpful to think about which metaphor clicked for you best, because it's really handy in the first step of dropping anchor to bring in a diffusing metaphor. And I'd like to talk you through this now. So if you can lower your gaze or close your eyes once again and listen to my voice. Think of some thought you've been having recently, or just choose the not good enough one. And allow yourself to just be confused with that for a few seconds And now we're going to acknowledge that thought is here and see it for what it is. A story, a passenger on the bus, a thought broadcast in the radio of your mind, the brain helping you to survive, or a movie. Notice that you are not this thought. You are more than this thought. And allow yourself now to connect into your body. Notice where your shoulders are, where your breath is. Allow your breath to flow automatically. Allow the expansion to come with the in-breath and a release to come with the out-breath. And notice just as your breath comes and goes, the thoughts in your mind also arise and move and shift. And staying in contact with your body, notice where those thoughts are now. We're expanding our sense of awareness from our thoughts to our body and then out to the wider environment. So just allow yourself to look around you gently now. Use your eyes to take in the environment and notice that you can engage with what's here. You can engage with my voice and you have a choice. And right now I'm going to ask you to bring your attention again to your thoughts, to acknowledge what's here. It may be the same or different to the thought you started with. And connect once again with your body. Notice the weight of your body against the surface you're resting on. Notice how you're held by gravity. Notice you're able to move your wrists, to circle your hands. Even in the presence of difficult thoughts, even in the presence of a storm of emotions, you have some capacity to direct your attention, to move parts of your body. And now engage. Engage with your environment. Notice you're able to engage with your environment whilst aware of your body and whilst aware of your thoughts. Notice you're able to engage with who you are right now. And this is the process of dropping anchor, of grounding down, of becoming more aware of who we are and what it is we want to do. And this is developed from the work of Russ Harris. And we very often cycle through these phases of acknowledge, connect, and engage several times. So to summarize, we can't stop the storm. An act is not about feeling better, although people very often do feel better. It's not guaranteed because when we drop anchor and we have that storm howling around us, our intention is to stay steady and to move towards engaging towards the life we really want to live and taking control of our actions. It isn't always going to feel good. Sometimes it feels very difficult. But the act of moving towards what we want is helpful to us. It helps us move into the life that we want. And at some point, it's very, very likely we're going to feel better. I've never encountered anybody that hasn't felt better. But the priority of the process in that moment is not to remove emotional charge. So I hope you can benefit going forwards from dropping anchor and from diffusing, and that you found a metaphor that you like. So there are 3 things that you may like to say to yourself as you go forwards in your day, or to notice. I can be present even when the storm is strong. I am not my thoughts. I can step back and choose how I respond. I can move towards what matters, even with difficult feelings present. And that concludes the presentation part for me.
Thank you, Vickie. Short and sweet.
Thank you.
And I must say, your presentation was so hypnotic. Okay, thank you guys. We shall start our Q&A segment right now. Just a little disclaimer for those who came in halfway earlier on because we had some technical issues earlier on. So we do expect some delay. We won't end at 9 p.m. Singapore time on the dot. We might delay about 10-15 minutes, and I'm sure most of will agree that this is time well spent. All right, let's proceed with this first question, shall we? How do you start the ACT conversation? Is it a process or a conversation or something else? Vickie?
Well, it's really important when we work with somebody in ACT that we explain to them the way that we're working. We talk through why we think this modality is going to be useful. It's not always the modality that I'd use and think is most useful. But I do need to explain to people that I'm not going to, particularly when I'm using hypnosis, I'm not there as a magician. I'm not there to eliminate uncomfortable thoughts and feelings that arise. What I am there for is to help people deal with the inevitable difficulties of life. And if they don't have external difficulties, like the way that people look at them, because many people are walking around experiencing difficult thoughts and feelings, it's to help them realize that it's not their fault. It's really important that people realize that they're positioned as they are in life and nothing is their fault. So I use a lot of self-compassion work. And yeah, my presentation was a bit brief because I was aware of the technical difficulties.
Yeah.
So.
Sure. Yeah. But earlier on when you were facilitating this, it sounded and felt very much like a mindfulness exercise, even some form of visualization and hypnotherapy. Could you just comment a little bit about that? Because I think there are some questions related to that.
Well, it's interesting actually, because it's really important when we work with ACT that we take people through the processes in the room, that we're not explaining to them what ACT is and then sending them away with stuff to do. There is often homework to do or experiments, or we can phrase it in many different ways. Some people really like being given tasks and some don't. And if people are motivated and they want to change, this is a really good modality for them. But very often just learning about this way of seeing the brain is helpful. And going through mindfulness-based exercises, it helps people come into a more receptive mode for a start, but it gives them an experience of how they can relate to themselves and their thoughts differently.
Okay.
So just as on a mindfulness course, I always do a meditation. When I'm working with that with people one-to-one or in a group, I will take them through a process that's experiential.
So it's really part of a process. It's not a treatment in itself. Yeah. Okay.
And I've just seen, what if the client can't think of a metaphor during a session? It's not the client's job to come up with a metaphor. It's my job to listen to the client's language and to find a metaphor that's going to fit the client. And to ask them about, does this resonate? Does this work for you? And then see if we can find one that does. Sometimes clients like a metaphor, but after a few sessions, they switch to a different one. So it's a really fluid process.
Okay, can we just jump to this one? I know, guys, there are some being ranked really high, and I will address those later on. What I'm trying to do is also to cluster the questions. Can ACT be used separately from mindfulness? We cannot stop the automatic thoughts nor the storm. The distancing of ourselves from the thoughts appears more important. Please advise.
ACT is very mindful. Can it be used separately from mindfulness? I'm not sure that a life that is lived with intention and awareness and presence is separate from what mindfulness is at all anyway. So mindfulness is a word that's been taken over by the West, and it's been studied, it has definitions, but really it's about living in the moment, living with values and purpose. So I would say that any therapeutic modality is helping people become more mindful and aware.
Yeah. Being more present in the here and now. Yeah.
More present here and now, but and also aware of the people around them, the relationships.
Yeah. Okay, now I'm going to kind of switch gears a little bit and go to the negative connotations here. What do you do during depressive suicidal thoughts? I suppose during the exercise where, you know, um, during the segment, the A, where you have to acknowledge stuff and you get such thoughts. So I assume that because this is also closely linked to this, how do you act in situations where another's negative thoughts and opinions affect you as well? Meaning the therapist. Any thoughts?
Yeah. So I I work with people who have depressive suicidal thoughts. So obviously, if somebody has taken an action towards suicide, then I have to go to safeguarding and I signpost them appropriately. That's something I had to do very recently, actually. I can still work with them. I work with people who experience suicidal thoughts quite a lot. And what I do is I help them see that that is their mind, in a way, trying to find a way out of the deep despair and suffering that they have. When they hear that, very often they stop feeling guilty. They stop heaping judgment upon themselves. When they learn that many people do experience suicidal thoughts in response to suffering, that it's a way out that can seem normal, very often their mind calms down, they shift, they change their relationship to those thoughts. They don't take any action. And very often, though, that storm calms down all by itself. So, however, if somebody is suicidal, then I have to be very careful. And I work in collaboration with other health professionals.
Okay. Do you still use the ACT approach or the ACE approach?
Yes, I do.
Okay.
Yeah. It has to be handled very carefully.
Yeah.
So yeah, you'd maybe move through it a little bit more quickly, but we'd be looking at the thought as a thought. Just because somebody is experiencing thoughts of suicide doesn't mean they need to take any action towards it at all. It doesn't mean that they're going to. And when they're able to entertain that thought, like, are you familiar with Rumi's The Guest House poem? It's a beautiful poem, and it's about a man entertaining all the thoughts that come his way. And he entertains them, and they come and they go. And when we allow space for these really disturbing thoughts, we can deal with them more effectively. We're not trying to push them away and tell them that they're wrong, basically. Nobody's done anything wrong because they're having suicidal thoughts. It's actually quite common.
Okay. And I suppose that will be the first step to acknowledging and acceptance later on. Yeah.
Yeah.
Let me link that previous question to this because it's almost relevant. Can ACT help someone who is not recovering from MDD for almost 4 years, major depressive disorder? And can ACT be used for people with personality issues?
Yes. The way ACT works is with each person as an individual. So, and it's very much the relationship. So we don't tend to categorize people into diagnoses. It's obviously relevant, but the way we work with people is with what is there in that human being.
How about if, MDD would be pretty severe, especially with psychotic, symptoms, where sometimes they can be delusional. So I suppose I would be interested to find out if it's someone who is in that state, how can you use ACT? Is it still relevant?
Yes. So I am currently working with somebody who experiences psychosis. However, I am signposting him to other services. And whilst we wait, I will be working with him. ACT is going to be used very gently in those circumstances. And I don't feel that I'm the best person work with that long term. But I do know ACT practitioners work with it very effectively with psychosis. So I was reading recently about how it can be used in psychosis and major depressive disorder. And each individual therapist or practitioner will make their decision on where they're capable of working.
Okay. All right, let me move on to the next couple of questions. It's a quick one. Is ACT a type of hypnosis or visualization technique?
No, it really isn't a type of hypnosis. I'd say that I'm quite unusual in being a hypnotherapist and using ACT. There's a lot of hypnotherapists that I'm in contact with that are using a lot of willingness at the moment, willingness to turn towards symptoms. There's a real recognition that resisting our pain and trying to fight it and trying to hide from it, trying to distract from it isn't always the best way. Distraction is, of course, useful sometimes. We all use distraction when we're uncomfortable, but when it gets in the way of us living our life. So we use distraction in ACT, but not very much, really. Not unless it's useful. I've forgotten the question. What was it again?
Is ACT a type of hypnosis?
Oh, yes. Oh, no, it really isn't at all. Because I'm a hypnotherapist, I do weave it in because it can sometimes help people embed it more.
Yeah.
But it really isn't, no.
So you can integrate, right? You can integrate ACT.
Yeah,
you
can, yeah. So long as you're working towards psychological flexibility, towards helping people take committed action, towards working with people's values and what really matters to them in their life. So we're not trying to get rid of stuff. So I'm working with somebody at the moment who's highly anxious in certain situations. And I'm trying to explain to her that we can't get rid of the anxiety and then move into the situation. So there's a lot of exposure in ACT as well. And the willingness to move towards that exposure and the understanding of why is really important.
Okay. I do want to add in my own question to this question. How can we support clients who can't distinguish between helpful and unhelpful thoughts, and by extension, painful thoughts as well? So like you said, being exposed to, I'm not sure, maybe even triggered memories. And since the first A in ACE is to acknowledge, can a feeling or a memory be so painful that they can't accept, they can't acknowledge it?
Right. So that question had two parts. What was the first part?
This one on the screen. How can we support clients who can't distinguish between helpful and unhelpful thoughts?
And the painful. So helpful and unhelpful, what we do there is a lot of values work and really help people understand what it is they really value in their life. And values are distinct from goals. Would you like me to go into that? So,
yeah, I think we can.
So we can have a goal, and I may have a goal to, I don't know, ride my bike for 25 miles. And that's something that I can achieve at a certain point in time. What value is it that underpins that goal? Is it the camaraderie of being with a cycling group? Or is it perhaps enjoying being solo on a bike because I'm getting away from the family? Is it fitness I value? So the values that we have, they're like a river that go underneath our goals. And we can always live in our values or make steps towards them. Whereas our values help move us towards our goals. So both are really important. But what we move through to get to our goals is our values. And something that's unhelpful is something that's taking us away from our values and what we really want. And so there's I use the choice point quite a lot in ACT to help people understand where they are standing and how to make decisions. But I can't go into every aspect of it in a short presentation.
Yeah.
And then the other question was about painful thoughts and memories and how we deal with those very gently, titrating them, working with sensitivity, being a human being, really. And was there anything else in that question that I haven't answered?
Yeah, I mean, that is linked to this other question on the screen. How do we navigate severe nervous system dysregulation or flare-ups as opposed to just thought patterns during act.
How do we navigate our nervous system dysregulation?
Yeah.
So yeah, this is interesting because there is a act that deals with trauma that's highly embodied, that integrates polyvagal theory and the somatic aspects. I like to work with the body quite a lot. For this presentation, I really did focus on thoughts because it's simpler and it's just easier to deal with one thing.
Okay.
But it deals with them with accepting, moving through, using the somatic therapies, because anything that will enhance psychological flexibility can get folded into ACT.
Yeah.
And when we work with our nervous system, we're really increasing our flexibility.
Okay. We've probably got about 3 more questions. Let's just go through them. These are pretty straightforward. How to make the metaphors in ACT for children between ages 7 to 12 understand and relate to?
So when we're working with metaphors, if this is a clinician, the thing is to listen to the child's language. Children live in the most amazing imaginary world. We listen to their language and we weave a metaphor with them. So it's really collaborative. And that's the best metaphor, really. There's all these nice metaphors of passengers on a bus and the brain talking to you. And people often relate to 1 or 2 of those. But the best metaphors are the ones that come like right from the guts of the client.
Okay. What is the ego's role in the process of anchoring and diffusing?
Well, it depends what definition of ego we're looking at here, really. So
Very technical. I suppose not the subconscious. Yeah, I mean, we can only assume, right? That's a quick response,
quite...
Vickie. It's a bit...
It depends what the ego is. Yeah, like how are we defining the ego? So I don't quite know how to answer. There's so many definitions of ego floating around.
That's right.
Does it mean the volitional self or
Yeah.
who?
Conscious
Yeah,
self.
the construct itself. Because one of the things that ACT does is it does help us widen out our sense of self. The act of diffusion, it helps us step into something called self as context, where we recognize that we are the notice of our thoughts. We are not our thoughts. We are larger. And then so with people who've got a spiritual inclination, sometimes that links with them really well with spirituality and the dissolution of the ego. And if people aren't spiritually inclined, it's a very pragmatic tool.
Yeah. I like that principle. I like that idea of we are not our thoughts. We are larger than our thoughts. There's so much more that we have to discover about ourselves. Very quickly to this one. This is a straightforward question. Is the values waving of one similar to SFPT miracle question? Solution focus. Yeah.
I guess so, except for it's trying to elicit what somebody's values are. And there's lots of ways of trying to elicit values. That was just a quick and easy one that can be used on the hoof.
Yeah.
But we're trying to help people move towards a solution for them.
That's right.
And it's a good question, the magic wand.
Yep. So it's almost similar, right? Miracle question.
Yeah.
And then there was this, where is it? It's gone. All right. Okay. Can we practice act on a person on substance abuse?
Yes. Yeah. Definitely. It's people use things like urge surfing. It's not an area that I'm experienced in, so I can't really talk to it. But I know it is used in substance abuse very effectively, yeah.
Okay. Well, there we have it. We've got everything covered.